all our faculty members. Good day, good evening, good morning, depending on where you are connecting from. It is quite another time that we share, and we are privileged to be with you today on this call. Many thanks to our faculty members that have been able to join, and our colleagues and participants from Lesotho, despite being this evening. Back in Lesotho, we have made efforts to join, and we hope some of our colleagues will make a way as well. It seems like tonight we haven't seen much of the challenges regarding connection, so probably it's just a matter of time when others will connect. This is our 5th week. It's unbelievable, but it's exciting as well to see that we are almost towards the end of our program. But we will also want to reflect on the fact that we have been on many sessions, which we hope and believe that they have impacted each one of us in a positive way for the benefit of the patients, service users, and their relatives. We started off September 5th with the introduction to palliative care. Then we moved on to culturally sensitive communication, including grief and loss, and how to conduct breaking bad news. We moved on to pain assessment and management in a limited resource setting. And then last week we had symptom management, as well as involving some elements of end-of-life care. This week, we will have our colleague and faculty member, Harriet, who is also the Starlight trustee, and she will be coming over to share with us the self-care for health and social care workers providing palliative care, because we take on so much. We still have our own lives, our own challenges at work and life in general, as well as really encountering so much emotions from those that we serve. So it's best we look after ourselves. Following that, we'll have the case presentation by Cristina, but we will also have a bigger discussion in a bigger group. So this is how our day is gonna be. So may I please take this opportunity to ask Harriet to come over. She will introduce herself, and we can just enjoy the wisdom and information shared as she continues to engage us throughout. Thank you very much. Harriet, you can carry on, please.
Are you sharing the slides for this? We got them to share.
Oh, are you okay to share, or should I?
Please share. I haven't got them on here. But while you're doing that, I'll just introduce myself.
No worries.
So my name is.
Do that.
Thank you. My name is Harriet. I am, as Tebello said, one of the trustees for Starlight. My day job is that I work in mental health. I'm an advanced clinical practitioner in mental health. And I also am a lecturer in university at Coventry University. So this particular session on self-care, I don't work in palliative care, but I work in mental health, and kind of like really wanted to bring this idea of self-care to the forefront, because working in palliative care has got possibly the same challenges or even more than working in mental health, in the sense that you're working with people and their suffering, and human suffering is always really difficult to cope with. And so we need to be thinking about ourselves when we are working in situations like that. So Tebello, if you can just bring me to the learning objectives, which might be the next slide. There we go. So really, last time we did this session, we kind of like went completely over time because there was a lot to go through. So I'm going to go through these first few slides really quickly, just to give a bit of an overview around why we feel it's important to talk about self-care. And as you can see there, those are the learning objectives for today. To think about why is self-care important, to identify clinical challenges in clinical experience, which we will do through the case studies. and also to think about how you develop your own self-care plan and self-care strategies as you work in these difficult situations. So next slide, please. Is it coming through, or is it me that can see? Oh, there we go. Oh, I can actually do it from this end as well. Okay, so first thing that we really just want to think about, we've been talking about palliative care and everything to do with the patients up to now, but as we've been talking, we've really been hammering into this idea of total pain in the context of thinking about the patient. But you also need to think about yourself as you are looking after people. So what does self-care mean to you? Because healthcare workers are inundated with reminders not to neglect themselves, not to neglect caring for their own body, their own mind, while working and caring for others. In as much as we promote holistic care for our patients, the concept of total pain that we've been talking about, how much do you consider about your own holistic well-being? Well, that's the challenge I'm putting to you today. How much do you consider about your own holistic well-being? And in so doing, how do we give or how do we promote how we look after ourselves? So those are questions that I'm just putting out there for you to really start thinking about. If you are already doing something, if you already have this down to a T and you're already looking after yourself, you can drop some stuff in the chat for others to look at. But that's kind of like the starting point. Because there is this saying, as you can see there, that the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. There is no way we can work with suffering without experiencing a suffering ourselves in the sense of compassion. Okay. So next, please. So when we talk about self-care, we are talking about a promotion of positive well-being. So positive well-being for yourself. And what does this look like? Well, the World Health Organization defined positive well-being as a state of well-being in which an individual, that's you, realizes his or her own abilities, they can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to their community. There's also other organizations. So this second description comes from a white paper from the UK government, which said that positive well-being is a state of mind, positive mind and body, feeling safe and able to cope with a sense of connection with people, communities, and the wider environment. So there is something in feeling well or having a positive well-being, which means work is part of it, but rest is also part of it. Being able to contribute to your community is part of it, and being fruitful is part of feeling well. And a lot of the time, we can find ourselves getting so caught up in the day-to-day of the difficulties of work that all these other needs that we have as human beings go out of the window, and this can lead to a lot of stress for us. Okay, next one, please. So we need to actually have an ability to feel in control. That's what makes us feel like we are well. Feeling in control, being able to make rational decisions, being in touch with our feelings, being able to form positive relationships, feeling good about ourselves, and knowing how to look after ourselves. All of that is a state of being, of having positive well-being. But this can be, there can be problems in terms of our well-being because of the actual work that we do. We can move on to the next one from that one, Tebello. We can find it difficult to maintain positive well-being because of the stress of how we work, of working in palliative care. And some of the stressors of working in palliative care are those that are mentioned on there. Feeling that you're not doing a good job, because sometimes you can't quite see any changes in the people you're looking after, and the suffering gets worse rather than better in some cases. So it can feel like you're not doing a good job. Frequent exposure to suffering and death, the team conflicts that can come around from how we work and the stress that comes from it, lack of support sometimes in the work environment, the workload itself, which can be overwhelming, and then the stress of just dealing with other people's distress and heightened emotion. So doing this all the time, over and over again, it then starts to have an impact on you as well. And then this then leads to, let's move on to the next one. And the next one again. What this can then lead to, if we are exposed to stress over and over again without actually having any way of coping with that, this can then lead to burnout, which is this progressive loss of idealism, of energy and purpose, which is experienced by people in the helping professions. So physical exhaustion, emotional exhaustion, depersonalization of the work that you're doing, a sense of incompetence and a lack of achievement. People who are experiencing burnout are turning up to do what they need to do in the moment and go home. There's no longer a connection to the work, and this feels really, really difficult to continue in that situation. It can also lead to moral distress, which is an inability to cope with what is going on around you. I've lost that. What's happened to it? Let's go back a minute. Okay, it's okay. Yeah, there we go. Moral distress is the inability to act in a manner consistent with one's personal and professional values. So when you see you turn up at for your appointment and the nurse is ratty and angry and shouting at everybody and not being able to really take on the professional values, that could be a sign of stress or burnout, which is leading to moral distress. And then finally, compassion fatigue, where there is just a diminished emotional energy needed to care for patients. So you're no longer connected to what you are actually doing. And that can all be very, very difficult to cope with and to manage. Okay, so you can go to the next one that you had moved on to. When this is happening, the impact of burnout then leads to errors in care, medical errors, all sorts of different errors when you are working with people, lower patient satisfaction, longer post-discharge recovery for patients, unprofessional conduct and less altruistic values, and avoiding work or specific work tasks which are difficult, avoiding people or avoiding dealing with difficult emotions, and eventually the thing that we don't want, which is professional exit, where people just stop doing the professional caring jobs because it's just too difficult and they've had to leave. So we really need to think about how we care for ourselves in order that we don't get to the point of burnout, to the point of being in a situation where we are either no longer able to function effectively or we are actually thinking of leaving the professions. So my next thing that I really want to hammer in on then is really about, if this is, what do we do in order for us to stay in this situation where we don't get burnt out? And the biggest thing is that we need to develop resilience. True well-being requires resilience. So to protect from stress and burnout requires an element of self-awareness and resilience and boundaries that Mayor John said at the beginning. There is a need to examine and redefine an approach to developing resilience that ensures you have some control of your own well-being by promoting your own self-care. A journey to resilience requires that one is in full control of their own thoughts, their own feelings, and their own actions. You need to know where you stand so that you know yourself, you know how you think, you know how things make you feel, and you know how to act in order to manage those difficult emotions you're looking at. So the next few slides, you can move on to the next one. We just want to really think about what is resilience and how do we develop resilience in order for us to work within difficult situations more effectively. So again, if I ask the question, what does resilience mean to you? I wonder if you can just drop some stuff in the chat box about what the word resilience, when you hear the word resilience, what does it bring out for you? But here on this slide is some words that other people have dropped whenever there's been talk of resilience. So whatever you drop into the chat box will end up on this slide for the next cohorts, because resilience really is about being flexible. So it's flexibility, being in control, bouncing back. So when there's been something difficult that's happened, you bounce back. Your bounce back is resilience. Elasticity, how much can you be stretched before you are coming back to the same position, remember, in elasticity. It is the ability to be adaptive. It is resourcefulness, or things like coping. All of those are kind of like words that have been, people have kind of like talked about in relation to resilience, and some that you're putting in the chats, like soldiering on, strength in difficult times. Soldiering on, we want to talk about a little bit, but we will do that later on. Looking beyond challenges, or being able to work with them, perhaps, and that sort of thing. Absorbing tough times. So yeah, so you are all having this idea about what resilience could look like. The problem is, do we know how to develop resilience? So let's just go to the next slide, please, Tebello. So the American Psychological Association defined resilience as the process of adapting well in the face of adversity, trauma, threat, or stress. So it isn't to say that you are not going to experience the trauma, stress, or the threat. It isn't to say the situation on the outside changes, but what is changing is your ability to adapt to it, to be flexible, to be able to stretch a little more. And that needs an exercise of what you have on the inside in order to be able to stretch further than perhaps you thought you were capable of doing. Okay, next slide, please. So the key components of resilience are connectedness. So your connectedness to other people. So it's got to be connectedness in the sense of maybe the term should be appropriate connectedness. So the right people. You are connected to the right people who are supportive enough that you can actually grow yourself. The second aspect is healthy thinking. The third aspect is meaning. This is about your sense of meaning to what you are doing. And then the fourth component of that is well-being. So you need all of those things to develop resilience. So next slide, please. So the path to actually getting there is about having an understanding of how people are wired, which helps us to build our own resilience. So people are wired this way. Everybody has got thoughts, have got emotions, and these thoughts and emotions affect how we act or how we are on the outside. This is the way we all are. So you need to understand yourself in terms of your mindset in relation to thoughts, emotions, and actions in order to build a resilient path for yourself through your own self-care plan. Okay, the next slide, please. The that is in the wrong place. Let's move on to the next one. We'll come back to that one. So generally, what we know about human nature and the way that we are wired is that we all have thoughts in our mind. The thoughts then affect how we feel, and then how we feel affects how we act on the outside. But the actual beginning, the starting point, is actually the thought. So in order for you to understand why you feel stressed or why you are feeling the way that you're feeling, you need to understand the thought that is behind it. Most of the time, we are not aware of the thought. We only become aware of the feeling, which is the stress bit. And when we get the stress bit, the middle bit, the feeling, it then affects how we act, which is then we are now not able to function effectively in everyday life. But the first point of call should actually be looking at what is going on with the thought. So just go back to the slide before a minute for me, so we can look at what thoughts looked like before, not. So in order for okay, yes, the next one, the thoughts one. That one. About writing our thinking, we need to have an understanding of our own thoughts. And in order to do that, we need to have an ability to introspect, to actually go back and think and look at what is happening with our thoughts. So in any situation when something is happening, you want to actually recognize the thought that is at the beginning of that feeling. So the next thing would then be to identify the emotion. What emotions are you experiencing and why are you experiencing them? So emotions are necessary in our road to resilience, because in normal circumstances, our emotions, our mind's alert system, they help us because they're a trigger. They're like what pain is to the physical body. Emotions trigger introspection. They trigger for you to think, why do I feel the way that I feel? So when you get a particular feeling, always think, where is the thought that has triggered me to feel the way that I feel? Emotions indicate that something has happened without really telling us what. So if you imagine, if you become quite overwhelmed, the feeling of being overwhelmed does not give you information about what has overwhelmed you. The information is in the thought, because if you go back, you'll then find you might be overwhelmed because you've got too much of a workload. So your mind, your thought is, I have too much of a workload. Your response in the emotion was to feel overwhelmed. So emotions will tell us that something is wrong without really telling us what is wrong. And we are generally very well versed in identifying the sources of positive emotions like joy, love, happiness, and things like that, which are positive. But we are not always so good at identifying the source of negative emotions, which tend to just overwhelm us. So we need to have an understanding that it's not the emotion. The emotion is not the problem. The problem is the thought that is causing the emotion. So in order to manage our feelings of being overwhelmed, our stress on a day-to-day level, we have to go to our thoughts. And the only way we can address our thoughts is to actually write our thinking. So there is a slide, I think it might be before, I don't know whether it's before or after Tebello, which is talking about challenging our thoughts through introspection. That one. So when we are experiencing feelings of stress, we need to challenge our thoughts because it's coming from the thought process. And we can do this through introspection. Introspection is an ability to actually challenge what is happening in the thoughts, because generally what you are saying to yourself is not necessarily the truth. So you need to recognize any unhelpful thinking patterns through introspection. When you recognize them, so the example of I've got too much work, or the workload is too much and I can't do it, is an unhelpful thought. So you've recognized it. You then resist it by sorting it out, sorting out the facts from the information and focusing only on the facts that are important. So I can't do this because the work is too much. Needs you to then sit down and say, how much work have I got to do? And then break it down and then see actually how can I do this work in a better way? And then now you are starting to resist the thought, because the thought is saying you can't do it. But the reality is you probably can. It's just come all at the same time and you don't know how to separate it out. So you recognize the unhelpful thought, you resist it by sorting out facts from information and focusing only on the facts that are important. And then you replace the unhelpful thought with the true information that is helpful for you to do what you need to do. So always recognize, if you're feeling overwhelmed, you're feeling things are getting too difficult, sit down and do this. Recognize what is causing you to think that, resist it by actually sorting it out, taking it out, looking at the information and sorting out what you think is happening to what is actually happening, and then replace it with actual information that will help you to deal with the situation at hand. Okay, next slide, please. Next one. Next one, I think, because we've kind of like touched on that. So the mind triggers emotional stress when one of its three needs are threatened. That's the needs oh, maybe we didn't. Go back a little bit. I'm sorry, I'm going all over the place with this one. In terms of emotions, our emotions, like I said, as I intended to actually help us to understand something has gone wrong. And our emotions help to keep us in equilibrium. Our mind has got three needs, which it protects at any given cost. It will, if any of these things are threatened, negative emotions are the warning that trigger us to introspect. So these needs, these are psychological needs. These are what you need, your mind needs to stay well or to have a sense of well-being. The need for security, for significance, and for esteem or dignity. The need, the need to just be known as somebody. If any of these are threatened, the mind will release negative emotions such as stress. So every time that there is an equilibrium, this will happen. You start to feel like you are losing it a little bit in terms of your emotional and well-being. You need to introspect. That means you need to go back into your thoughts to see what is causing. Where have I been triggered? Where is the problem? Which is the next slide about emotions. So every time there is an imbalance in that security, significance, and self-worth, the mind triggers emotional stress when one of those three needs are threatened. In the same way, the body invokes pain when it is at threat of physical injury. So if you find yourself feeling overwhelmed, something has triggered in your mind that either you are insecure, there is something that is threatening your security, there is something that is threatening your significance, or there is something that is threatening your self-worth. And your mind will automatically release negative emotions. So stress is a negative emotion. And in order for you to understand where it's coming to prevent it from overwhelming you, you need to go back to the source of the thought and to see which part of your thing has been triggered. Because in the same way as if you get paid in well-being. Okay, next one. Next one. You can go through these to kind of like do a little bit more into these emotions. But definitely, if you are understanding your thoughts, if you are looking at your emotions and taking them back to thoughts, this will give you a planned way of how to look after yourself. So you need to have compassion on yourself. You need to recognize that the situations you work in are difficult. You need to recognize that you do a really, really good job with other people's well-being, and that in order for you to stay well, you need to give day-to-day basis will affect you, because you are a self. Self-compassion is very, very important. And we need to be mindful and aware that our problems, they are problems, but we need to be unbiased about their impact. We work in difficult situations, so we don't need to pretend that it's not difficult. We need an unbiased awareness and perspective of how difficult things are for us, but we develop self-care and resilient plans that help us to move so that we don't feel pressured all the time. The importance of self-care was shown in one paper that showed that support workers or people that work in health and support areas, when they practice good self-care, they are able to have satisfaction and resilience. But when self-care, when it's all about self-sacrifice and poor self-care, it leads to fatigue, burnout, and dissatisfaction. So this middle bit about actually being aware of yourself, looking after yourself, leads or is the pathway that will lead to satisfaction and resilience. Okay, I think the next one might be the last one. So part of ways of actually looking after yourself and ensuring you are walking a path that actually leads you to resilience, apart from being able to introspect and look at the situation in that way, is to also just make a conscious effort to do things that help your well-being. The 5 ways to well-being is a very well-known way of thinking about well-being, which suggests in the same way that the body needs the 5 fruit and veggie a day, the mind also needs its own 5 a day or a week, or however you want to do this. But all of these things have been found to be the best way to maintain good well-being for your mind in order to maintain resilience. So connecting means just having connections with other people. Being active has been found to actually increase the number of feel-good hormones, the pheromones, which then means you're not feeling so overwhelmed and stressed. Keep learning like you are doing this evening, just being able to actually do something outside of your everyday, day in, day out, that actually brings your mind to a place of exploring other things. Giving has been found to be a good way of maintaining well-being. And this does not just mean giving money. It can be giving your time, it can be giving your resources, it can be just listening to somebody. All of those things help you to stay well. And then taking notice, which will be my challenge for you this week, is just, when you're just going out for a walk or you're walking home from work and you suddenly look up and you realize, oh, the trees have got leaves now when it's I don't know, you're coming out from winter or something, and you suddenly notice something is happening in nature. You are aware of the birds chirping, you are aware of the road. We completely forget to take notice of life around us when we are very busy, because we stay inside and we are thinking about the next thing we need to do. So these are your five ways to well-being, which will really help you to start to put a resilience and self-care plan together to help you do something to maintain your own self-care and promote resilience as you move forward. Resilience is a path. It's not a one-day thing. It's something you build as you go. So I'll leave it at that. And say the next, there's more slides at the end of this one, which you can look at to think about how you can develop your own self-care plan, self-care checklist. What things are you able to do? What do you like doing? And use the 5 ways of well-being as your starting point. So I'll leave it at that for tonight. Thank you.
Thank you very much for the wonderful information shared, especially this time we have been talking about our patients for the past 4 weeks. This is the only time that we have started looking at ourselves, how we can remain resilient, resourceful, and healthy enough to be able to support those that we care for. So I think anybody that might have questions, or if our faculty members have noted any questions in the chat, maybe this is an opportunity to respond or allow anybody that might want to share or ask or even to comment. Thank you. Anybody?
Incredible. I cannot get enough of this. I wish the presenter could go on and on. What a great lesson. We agree. Thank you so much.
I could, but I'm not allowed to.
Oh, thank you.
But
you.
I really believe passionately that if we are not looking after ourselves, we cannot look after other people. So it really has to start with an introspection about yourself in order that you are well enough to look after the people you're looking after.
It actually makes even more sense because I wasn't aware how much challenge it is in Lesotho, because we are only a little population of just over 2.1 million. Now, with the recent commemoration for Suicide Day, Lesotho has been found to be on the top of the charts for wrong reasons, not even number 5 or 10, just number 1 with the suicide rates, simply because our mental health is really needing a lot of attention. How we take care of ourselves as practitioners, how we take care of the society and communities, and how we need to actually work hard to dispel all the myths around mental health, as if somebody is going to seek counseling, it's because they are weak or they just want to share family matters to the rest of the outsiders and wash their clothes in the public. Whereas people need help, support, counseling, or somebody that can just validate their thinking and their emotions and put them centered. And just by a simple conversation that might get somebody to think properly about how they feel. So I think it is a very, very wonderful topic that we all take note of, to look after ourselves, our families, those that we care for, and to the wider communities that we serve. Anybody else that might want to say something?
I think, Tebello, the other thing, and I know we have many different types of healthcare and social care workers, but I do think that many of us, we're not necessarily forced into this profession. We've chosen it. And I think as we've chosen to be nurses and primary providers, it is our responsibility to take care of ourselves. I think we don't give good care when we're burnt out. Like Harriet said at the beginning, we can make mistakes, and I think that's just being human. But I think because we've chosen it, now we're also responsible to learn more about our own mental health. And I think when many of you are working in really remote settings by yourself, witnessing suffering, it isn't easy. These kinds of programs and courses and developing a community amongst ourselves is really important. And I think we should hold each other accountable. I know we talk about that sometimes more in faith-based conversations, but we know now that we know of each other, we should hold each other accountable, make sure that we're doing okay. If there's 1 or 2 other people on this call that you know, send them a message tonight and just make sure they're doing all right. Yeah, self-care is really important. There's one example we use when we teach caregivers here in Kenya about on the airplane, when you have the oxygen mask, they always tell you, if you haven't been on a plane, I will tell you, the stewardess or the flight attendants tell you to put the mask on yourself before you can help people around you or before you can help a child. And it's really the same concept. You will be of no use to anybody around you if you're not able to manage yourself. So thank you everyone for all the hard work you do.
Thank you. Thank you, Erin. Our dear colleagues, anybody that might want to share, ask, comment, because I think, Erin, in Lesotho, there's this notion or something that seems to be accepted by the public, that nurses are always loud, angry, and agitated. That is the common thing that seems to be accepted by the entire public. If anybody talks about the nurse, that is what is expected of a nurse to be. And I guess it's simply because if there's a lot of pressure at work, we still got our own personal lives to deal with, the spouses and the children, and anything else that is going on in our lives, whether we are studying or something. So all those things, they are all embedded on a person that is already taking on a lot at the professional level, maybe short-staffed, maybe short of medication, no equipment, and really struggling to cope with the day-to-day job. So in the end, there's this burnout, stress, and emotions are all over the place, and any trigger really prompted that negative feeling to come to the fore. And in the end, the nurses are clustered as, the nurses are always angry and agitated, and this is why this error has happened. A lady went for a labor, and this is what they do, and they didn't look after the baby and the mother and whatnot. So I think it is really to appreciate the fact that we are carers, like you are saying. We came into the profession because we care, but that caring should start with us. And being self-aware and trying to do our best to self-care, it doesn't necessarily mean being selfish. You just set it all. You need to put your own oxygen mask, ensure you are breathing and have energy to be able to get the other mask and help a child next to you or any elderly that is unable to locate their mask on the plane if something goes wrong. Yes, Ndadeti Nagane, would you like to say something?
Yes, so much. I'm excited to hear this because my understanding is that if the machine is working and there's never a time when it is oiled, that machine is going to break down, and later in a stage won't be having a machine to do anything. So for a change to hear that as healthcare practitioners, we not only expect us to take us, but as an individual, I have all that right to make sure that I'm taking care of myself. I understand myself. I know my emotions. I know, like for instance, if I know that now my temper is increasing, then it says, look at myself and just take a break a bit, and then after that I'll be better. So I feel this presentation was needed. I realized that after, for instance, COVID-19 pandemic continued as if nothing has happened. And the employer is still looking at the production, but we never look at us as individuals. Am I fine? Am I doing well? Am I participating in a way that I should participate? How about my emotions and my thinkings? So I feel this presentation was the best presentation in this. Well, as we are taking care, or as we are having healers, we should understand that we are also wounded, but we are healers as well. Let's take care of our wounds as we'll be healing others. Otherwise, all of us are going to die and won't be able to help those. Thank you so much for this presentation.
Thank you, Ndadeti Nagane. our chaplain on board. You have highlighted so much wonderful wisdom there, that even after all the trauma we all went through, as we looked after people that were really suffering and losing their lives, and even ourselves having experienced so much in our own individual lives, it is the right thing to do, to look after ourselves and to be able to be conscious that we might have taken a lot of stress. I think that there's a big message in your statement. Thank you very much, Ndade, for all those wonderful comments. And I think there's a lot of assignment to be taken from what you have just said. Mepalisa, would you like to say something?
Yes, thank you, Tebello. I really liked this presentation, because sometimes as nurses, we sometimes forget that we still do matter. We don't even look after ourselves. Like, you can even forget that it is time for lunch because of a load work, so many patients that you have to look after. Example, like in the mountain areas, sometimes you'd see that we are short-staffed. So it is really difficult for, let's say, one nurse is available in the clinic. Someone, she or he has referred a patient and you are left alone in the clinic. Sometimes that backlog, it is too much for us in the clinic. Thank you.
Thank you very much, May. Your perspective is a very special one and dear to me, because I know how challenging it can be working in the clinic, whereby you are a doctor, a nurse, a pharmacist, a social worker, and everything in one person, and a midwife. And yes, there's a lot that is happening to take on that workload, and still yet we are encouraged to take a break and really introspect and see how best we can really be able to look after ourselves and eat and drink and apply all those 5 elements that Harriet has mentioned. I don't know if Harriet, you would like to emphasize something on this point, because even in the chat, you've been invited to join Lesotho and be our champion for self-care, because we need this kind of care. Yes, would you like to say something, Harriet, or any of the faculty members, please? Nepalsa has really put across a lot of challenges.
Yeah, I was going to address that, to just say we work in challenging situations, and that's never going away. The ward is short-staffed. There's not enough people to work. There's not that's always there, and sometimes not being able to take a moment because you're the only person there will happen. But my challenge would be, as soon as you are able to, you need to take some time to refresh and to actually be able to look at where, because it's not always possible to take the time that you need to self-care in the heat of the moment, but not to allow the heat of the moment to then become you've gone home, you're still in the heat of the moment. You've moved on from that situation, but you stayed in it because actually you haven't taken time to do that introspection, to do that reflection of why this was so difficult for me. This day was really, really hard. And this is the reason it was really, really hard. And this is what I'm going to do to actually just distress and take some time out and do something that is about me, that is about self-care, which is why the self-care plan is really, it's really important. And there is suggestions later in these slides. If you've got them, I think you will have them, to just think about things that make you feel relaxed, so that outside of the work environment, you don't then just come out and go into another environment where things are really difficult without taking time to actually look after you. So it's not always possible to be looking after you in the heat of the moment, but you must have a plan of how, in the course of this week, where I have 1, 2, 3, 4 days, I'm working nonstop for 5 days or whatever it is that you are working, where is time for me? And what am I doing in the time that is for me? Somebody else put in the chat about the fact that they thought self-care was about spending money on yourself, which is kind of like how you were reading magazines, that's what they'll be telling you, that's what self-care is. But self-care is literally just looking after yourself. However you do that. If you do have money and want to get your nails done, then yeah, okay. If that's what's going to make you feel relaxed. But it does not have to be anything to do with money. It's about the inner environment. It's about looking after the inner environment of you and making sure that that stays in a positive state of well-being.
And in the charter, Erin has written self-care plans can include a physical aspect, which can just be walking or maybe exercise. And the emotional aspect of it can just include journaling, or even spending time relaxing or really listening to relaxing and, comfortable music for you, or even meditation or reading your Bible or praying, however it makes you feel. And you can just do anything that makes your mind come to a calm state. Sometimes I always share that for me, what I always find, because it can be really, really, stressful. Like you say, we work under these circumstances, and it can be short-staffed with a lot of demand, running between poorly patients who demand so much, and relatives seeking to ask questions and even complaining. And to go to the bathroom, you just take 1-2 minutes. Just to be out of that environment. You don't have to do anything. Enter the bathroom, just look at yourself in the mirror and wash your hands and think, just to allow that moment to get your mind be centered and, get your mind really recalibrated, because you can be in that heat of the moment that can even allow your emotions to just run loose if you are not careful, because we are only humans. I think we are coming to a point whereby we might now need to get ready to go to the breakout rooms. But if there's anybody that wants to say something from the faculty team members or even from our dear colleagues, feel free with this 3 minutes. I don't know who's going to help us with the breakout room, Sangam?
Did you want me to Tebello, we have to do the case. We have to do the case first.
Okay, so let's do this. If we want to let's just do the case 2, and then we'll put everybody in breakout rooms. And you have case 1. This is an important discussion. I never want to shut this down, because as you know, Harriet and I, this is our jam. This is where we can go on and on and on. I will add, as we're getting the slides up, that I really am a firm believer in developing a self-care practice a little bit at a time, so that you can fall back on it when you have one of those days where you've seen 8 patients, 5 of which have passed away, and you have to go home and still be a parent, be a partner, do all those things. Because when you have some grounding activities or exercises, like Erin has said here, maybe mine in the morning is grounding myself in meditation and prayer time, I can draw back on that at each step of the way when I encounter these difficult moments. And I will share, even from my perspective, as a clinician working through COVID, that was very much what my days were like. And it was distressing, but I had bookended my days with this time for beautiful meditation in the morning. And I was so fastidious about it, because it was what was keeping me grounded to go through those days. And then ending my evening thinking about, oh, I get to make dinner for my family as a way of expressing my love for them, not that I have to, right? And just changing that mindset for me was so helpful. And I don't even know how we all got through COVID, but that was something that was a very helpful practice for me. And it was just doing that very small intention, doesn't take too much time, but throughout the day, and finding something like that for yourself that feeds your soul, so important. Okay, so I'm Cristina Montanez. I am a professor in the counseling department. I'm a chaplain in the interdisciplinary team in palliative care and have been a clinician for about 8 years in this field, and then a counselor for, oh my goodness, on almost 20 years now. And so I'm happy to be with you. The experience that I bring is within the context of the American system, but also in the global space with our partnership in Malawi, and now all of the wonderful people that I'm meeting in the beautiful kingdom of Lesotho. And so I would love to facilitate this conversation. I will be teaching next week too on the spiritual aspects and some other trauma-informed care. But for right now, I'm going to compliment my colleague Harriet. This is my favorite lecture. So we'll get started with our case, and then we'll break out into breakout rooms with a list of questions that you can answer after I'm done presenting this beautiful baby here, who is a 4-month-old baby who presents to your hospital with an enlarged head for a 1-month-old and lower back lesion that they've had since birth. This is an open form of spina bifida. You can see here from the image, they've had a rapid malaria test that's been positive, including hydrocephalus here, respiratory distress, and fever. The saturation is 54 on room air and 93 on 2.5 liters. And so they've started on IV antibiotics and malaria treatment, exploring possible transfer for shunting and neurosurgery. And then next slide, we come into a different situation. So if you could advance next slide, we'll explain what happens next. Thank you. They end up having this acute illness of malaria, pneumonia, and possible meningitis. So because the patient's in a rural area, it's very far from any possible hospital, which could do a peritoneal shunt, a ventriculoperitoneal shunt. And so the care team would need to transfer this child to another country for the procedure. And the nearest neurosurgical centers are in a nearby country. So this is kind of a delicate situation. And so these are all the types of things that you as the care team would need to consider, and also how you would communicate this to the family. So if we can go on to the next slide, we'll see how it went here. So the team is able to discuss with their advisors via telemedicine. They present the case, and it's agreed that a VP shunt is not appropriate in this current setting. And so there's a variety of reasons why. The first is that there's a lack of expertise for follow-up. There's a huge likelihood that the shunt would block in the short term to medium term. And then also the care of hospitals would not be free. So we do have to weigh the cost as well. And with previous agreement with one of these hospitals, it had been discontinued because of poor outcomes for children. So there was a partnership, but they decided not to continue with that because there were some poor outcomes there, and then the risks associated with international transfer. So the other thing to weigh is that there would be a high likelihood that during that transfer, the baby would pass. And it could be a very traumatic experience for the family. All right, we're moving on to the next piece here. So the child was recommended for palliative care. And so we have beautiful experts on here that I would like to just acknowledge, Joan and Jillian, and also our colleague who couldn't be with us today, Julia Downing, and they work with the International Children's Palliative Care Network. And so again, they have wonderful expertise here that we'll see out here in our breakout rooms. But this was a recommendation for this child to go into pediatric palliative care. TAPS could relieve the ICP, but despite symptoms in the very short term, fluid always reaccumulates, and it created an easy route for further infection. So the prolonged the baby's life, but it didn't change or improve the outcome. So that was really important. That decision of palliative care is typically focused on comfort. And so if we see next slide, we can see what happened in this case. So after that treatment plan was put in place and was discussed with the family, who did accept the plan after a lot of education, they wanted to stay in the hospital for care. The baby was able to recover from some of its pneumonia and malaria, and stayed on the ward with comfort-focused plan. He rapidly deteriorated, and 3 weeks later, he died peacefully in the ward. So this has been a huge impact, as you can imagine. If you're in the hospital setting, nurses become very attached to people, and also certainly children and babies, and they found it really hard to cope with this baby's passing. So one of the pediatric nurses approached the pediatrician later that week and asked why wasn't the child resuscitated? And so we're at a place now that you'll break out into your breakout sessions, and we'll talk about kind of why the pediatrician organizes the team debriefing session, which is a good outcome. We'd like that to happen, because chances are that if this nurse is impacted to the point of asking the pediatrician, others are as well. So come on, the next slide. So these are the questions that we'll explore in our small groups. So what are some of the features in this case that could impact the nurses and other team members' experiences of moral distress with the case? So remember, moral distress, as Professor Harriet explained to us, is that feeling that the ethical values are in rub with your own ethical values. And so that can lead to moral distress when we're repeatedly put in situations where our ethical values or our personal values are in conflict with what the decisions are made in an administrative or a hospital setting, or even in an organization that is field-based. So again, exploring experiences of moral distress. What can the team do to support each other? And then what would you do if you were involved in this case to create a personal self-care plan? Because chances are, in settings like in Lesotho, like when we experience our pediatric palliative care in Malawi, we are in those situations frequently. And so making sure that we have that self-care plan that we can fall back on, and also proactively create, is important. So that's our case. You'll see the slide deck has a case 1 as well, but we decided to forego that so that we could just soak up the discussion from Harriet's lecture. We'll put you into the breakout sessions, and then please pick up on any of those questions. And we'll have, I think, Erin, about 15 minutes or so, correct? And then we'll come back as a big group.
Yeah,
And
maybe
Erin?
Cristina. Yeah, maybe you or Harriet could just summarize maybe just what your groups. I don't think we're gonna have enough time for everyone to share.
Sure.
But yeah, let me
yeah, so it takes us a minute to do this. So as you're thinking, Erin has put the questions in the chat. And is there anybody who would like to comment as we get people into groups? I'm thinking maybe Joan or Jillian, do you have a perspective that could help us here as we go into discussion?
I was just thinking that the team wasn't prepared before this child died. There was no advanced care plan that was developed. And this is why afterwards they were asking the questions, when all of these things could have been handled at the beginning in a team meeting, in a multidisciplinary team meeting. That was one of the things that really did strike me. And then the other thing was that there was a potential for cure with this child if they had been in the right place. And you know, that's that feeling of the unfairness of it.
That distress,
that moral distress as well. If that child had been, say, in Bloemfontein at the university hospital, it would have been a different approach. So those were just some thoughts off the top of my head, because it was a life-limiting condition at the end, but it could just have gone into the category of life-threatening with the possibility of effective treatment.
Thank you.
everyone, as we are still waiting for. Oh, welcome you back, everyone. I believe we will have made a lot of really fruitful discussion. My group was lively. Oh, exciting. But I'll leave this moment for Cristina and Harriet to wrap up all the key elements of things that they still wish to share with us as a summary of our session today. But in a nutshell, my group said, thank you both. What a wonderful session. They have really enjoyed it, and they have learned so much and been so much aware that they matter too. Yes, thank you.
So I will conclude with that you matter and you need to look after yourself first, because if you are depleted, you are no good for anybody else. And it is very difficult, which is one of the things that was said in my group. It is so difficult sometimes to think of yourself, because even when you've got the work issue, you might also have busy home life, you might have young children, you might have things that are going on, and you just don't find yourself in all of that. But it is key, it is important that you take care of yourself. Even with the young children, I say children are selfish. They are not ever going to give you time for yourself because that's the nature, that's just who they are. But they do go to sleep, they do go to school, they do go out to play. And in those times, you can actually take time for yourself, but you need to be intentional about it, which is why we recommend that you do some self-care plans. You think about, actually, this is what I like to do that helps me to distress, to feel well, to feel good about myself. Put it on a plan every week for when you are going to do those things. There are some examples towards the end of this the slides that I presented, where examples of things that you can put on your own plan that addresses your physical well-being, addresses your psychological well-being, your emotional and your spiritual. And you can put those on a plan, stick it on your fridge like you do your children's artwork or whatever, and make sure you're doing something for yourself every week. 5 a day for your for physical well-being, 5 a week, I'm going to say, for emotional well-being. So stick to that. There is a video as well on the 5 ways to well-being, which also gives some suggestions of some of the things you can do for those 5 ways to well-being. So that's me.
I don't have much more to add, other than I would love to reflect back some of the sentiments of our group, which was wonderful discussion. We had an interdisciplinary group, and so I think we ended on a couple of notes about exercising and rest, how important those are, and also making sure that when we're checking in with ourselves, we're doing so authentically. How am I doing today? Not just at the superficial level, whether it's with our colleagues, but even with ourselves. And then acknowledging I don't have it in me today, or I might need some help today from a colleague, from someone else, maybe at home as well. And how important that is to be honest with ourselves with regard to this. And you've taught us this whole beautiful model for introspection as well, which we hope to apply. When it comes to moral distress, we did talk about this idea of ethical conflicts that may come up among team members too, not just with patient and clinician values. And I think that's a nice segue into some of the things that we'll talk about next week as well, when we examine trauma-informed psychosocial and spiritual care in the palliative care setting. So it's really developing that idea of bracketing our own values so that we can enter into the worldview and experience of our patients and of our colleagues too, that we may not necessarily share the same perspective with. So Harriet, wonderful. I love doing this session with you, and thank you so much. And thank you to our group with the great participation as well.
I think you have said it all, and we are grateful for all your time. Without really holding back, we want to thank our partners. We wouldn't be here, we wouldn't be making this kind of sessions if they have not seen it necessary within their time and work plans to include us in their strategic plans that Lesotho can be a priority on their plans. And we are grateful that at least they can hear and feel for themselves that it was really an investment worth making. Thank you very much, our colleague in India, Sangam, to have stayed this late to support us. Thank you, our palliative care team, palliative care works team, Megillian, representing your entire team, and we wish you well as you prepare for the 10th anniversary of your charitable organization, which we were even not anticipating you'll join us, because we believe you must be busy in the background preparing for the 14th. Thank you, Paul Chase. We wouldn't be here if not you, Erin. We are grateful, entire team of Paul Chase and everybody else. Our colleagues and participants from Lesotho, it is an incredible joy and honor to be journeying with you as we believe to shape and change Lesotho for better. So many thoughts have been thrown on the table that we all need this self-care plan, not necessarily as a one session, but as a program that can support probably the new starters in the different professions we have, or even halfway through, or even, you know, intermittently. That is why, Harriet, you will receive an honorary citizenship. You've been invited to come on board in Lesotho.
I've accepted.
So, oh, wonderful. Honestly, we are grateful and thank you, and have a wonderful the rest of your day. Cristina, you are starting your day, so enjoy yours. We are going to bed.
Bye, everyone. See you next
Thank
week.
you. Sleep
Bye.
well.
Thank you.
Take care.
Thank
See you
you.
next week.
Thank you.